All right, everybody. Welcome to the second half of Chapter 14. We're going to continue talking about the autonomic nervous system and homeostasis. Now, in this particular section, we're going to discuss Chapters 14.3 and 14.2, and at the very end, we will discuss a very short Chapter 14 summary as a whole. So Chapter 14.3, we're going to discuss the parasympathetic nervous system, and then in Chapter 14.4, we're going to discuss the PNS's role in maintaining homeostasis throughout the body. Now, as we already discussed, the parasympathetic nervous system is often called the rest and digest division of the ANS. Now, this really relates to its role in maintaining the body's functions like digestion and urine formation. And these are typically carried out during periods of rest. You know, when you're not physically exerting yourself, or you're not under an emergency situation. And like the sympathetic nervous system, this system is rarely completely silent, although it is considered subordinate to the sympathetic nervous system. I previously also called this the craniosacral division, in association with its cranial nerves and pelvic nerves from the sacral plexus. Now, as you can see from this image, we're going to be looking at the cranio and the sacral divisions of the central nervous system to find out where the cell bodies of the parasympathetic nervous system's neurons lie. And as you can see up here in this region, the cranial region, you have many of these cell bodies lying within the midbrain and the brain stem, while if you go down here to the pelvic region, you're going to find some in that conus the conus region of the spine, and these are just going to be the cell bodies. Remember, these are the pre-sympathetic ganglion cell bodies. That's axons head out to the ganglion somewhere in the body. Now, you are going to find that the cranial nerves that house the parasympathetic preganglionic neurons, like the oculomotor nerve, the facial nerve, the glossopharyngeal nerve, and the vagus nerves, these are all located in the cranial region. Now, in the sacral nerves that house the parasympathetic region, these are located through S2 and S4, between S2 and S4. That figure that I just showed shows you that organization, and I'll try and show it again after this image, after this slide. Although 4 cranial nerves carry this parasympathetic fibers, the main parasympathetic fibers are the 2 vagus nerves, cranial nerve number 10. These work together to provide about 90% of the parasympathetic innervation to the body. Branches of the vagus nerve contribute to several groups of nerves or plexuses, and these plexuses work together to innervate specific organs. For example, the cardiac plexus innervates the heart, the pulmonary plexus innervates lungs and airway passages, the esophageal plexus innervates the esophagus. These preganglionic fibers will usually synapse on terminal ganglia that are located in the walls of the organ that are being innervated. And remember, these terminal ganglia are going to be very close or near, otherwise near the postganglionic neuron's target cells. So remember, I'm going to draw this image again. We had the spinal cord here, and then we have very short axons for the sympathetic system, right? That synapse into that sympathetic chain ganglion. And the sympathetic chain ganglion then has those very long postganglionic axons that will synapse onto the target cell, right? And again, this is reversed now. So now we have very long axons from coming off of the spinal cord as the preganglionic neuron that will synapse onto a ganglion, terminal ganglion, very near or often inside the target cells. So the length of these axons is inverted, where the preganglion is short here, the postganglion is short in the parasympathetic system. That is important that you guys remember the difference there. Now, there are other cranial nerves that also carry parasympathetic fibers. The oculomotor nerves carry preganglionic neurons of the parasympathetic system, and they synapse onto terminal ganglia called the ciliary ganglia. There are other terminal ganglia like the submandibular and the pterygopalatine, and these house the cell bodies of sensory neurons, and they're actually the sites of where preganglionic neurons of the facial nerves synapse onto postganglionic neurons. Okay, so this is going to be where that facial nerve carries these parasympathetic fibers. You're also going to find that the preganglionic neurons of the glossopharyngeal nerves synapse onto postganglionic neurons in small terminal ganglia called the otic ganglia. Now, the cranial nerve parasympathetic fibers will innervate much of the viscera of the thoracic and abdominopelvic cavities, okay, but not all of it. Now, the remaining organs, including the last segment of the large intestine, the urinary bladder, and the reproductive organs, these are supplied by the sacral neurons of the parasympathetic fibers, with parasympathetic fibers. And these, you're going to find branches from the sacral spinal cord forming the pelvic splanchnic nerves, okay? And these in turn form plexuses in the pelvic floor. And some preganglionic neurons will synapse in terminal ganglia in these plexuses, but most are going to synapse in terminal ganglia in the walls of the organs themselves. Now, both the preganglionic and the postganglionic neurons in this parasympathetic tract are going to release acetylcholine at their synapses. And generally, the effect is excitatory. Now, as we saw in the sympathetic nervous system, there are two types of cholinergic receptors. Remember, there are nicotinic and muscarinic. Okay? The nicotinic receptors are located in the membranes of all these postganglionic parasympathetic neurons, whereas muscarinic receptors are found in the membranes of all parasympathetic target cells. Okay, that's important. So the nicotinic are in the postganglionic neurons, and the muscarinic are in the target cells. We are now going to examine what happens exactly when this acetylcholine binds to these muscarinic receptors. Now, just like I said for the sympathetic nervous system, if you remember the function of this system, you can remember what its effects are. Okay, maintaining homeostasis when the body is at rest. I want you to think about what happens when you eat dinner and then sit down here at a table or your desk to try and comb through your textbook. Your heart rate's going to slow, blood pressure is going to decrease, you're digesting your food, your eyes are going to adjust for near vision in order to read the book. Okay, each of these effects is going to result from a decrease in sympathetic activity and the release of acetylcholine from pre- and postganglionic parasympathetic neurons. Now, I do have a figure that I'll show you guys that shows the main effects of parasympathetic nervous system on each of these target cells, but I'll speak on them as much as I can first. When we talk about cardiac muscle cells, remember, okay, the sympathetic nervous system is going to increase heart rate and blood pressure. So it follows that the parasympathetic nervous system decreases them, okay? Preganglionic parasympathetic neurons are going to travel to the heart from the vagus nerve, and they're going to stimulate postganglionic neurons there. These neurons then turn in and act to reduce the heart's rate of contraction, which lowers blood pressure. Postganglionic parasympathetic neurons innervating smooth muscle cells in various organs have various effects. Your pupils could constrict, okay? The fibers of the oculomotor nerve in the ciliary ganglion, these work to innervate the sphincter pupillae muscle, which constricts the pupil and so allows less light into the eye. So remember, when you're in your emergency situation, you're exerting a lot of work, your pupils will dilate to allow more light in, to just get more visual data in, potentially to escape a threat. The opposite is now happening. We're reducing the amount of light that enters the retina, that hits the retina. You can accommodate the lens for near vision. Those same fibers of the oculomotor nerve also innervate the smooth muscle cells of that ciliary muscle. When this contracts, the lens becomes more round, allowing for the bending of the light to accommodate for near vision. You're also going to find bronchoconstriction is an effect, okay? When vagal parasympathetic neurons stimulate the contraction of these smooth muscle cells lining the airways narrow. This is a response called bronchoconstriction. Remember, bronchodilation is what happens during sympathetic responses. This effect is typically mild. This bronchoconstriction is typically mild unless it is very, very strongly stimulated. You're also going to find that smooth muscle lining the digestive tract contracts. Again, this is from the vagus nerve that triggers contraction of these smooth muscle cells lining the digestive tract. This produces that rhythmic contraction. You may have heard of peristalsis. This is just this one area will contract and then the area next to it will contract, pushing that bolus or that chyme through your digestive system. It's propelling ingested food from one part of the digestive tract to the next. And you're also going to have relaxation of digestive and urinary sphincters. Now, these are both from the parasympathetic neurons of the vagus nerve, and you're going to find some pelvic splanchnic nerves do the same thing. They stimulate the relaxation of smooth muscle cells of both the urinary and the digestive sphincters. Now, these actions don't only promote urination, they promote the movement of digesting food from one area to the next, and this ultimately results in defecation. In both males and females, genital engorgement is going to occur. In males, you're going to have blood vessels of the penis, and in females, you're going to have blood vessels of the clitoris. These blood vessels are going to engorge. They're going to relax, leading to that vasodilation, engorging the penis and the clitoris with blood. And unlike the sympathetic nervous system, the parasympathetic nervous system really doesn't innervate blood vessels except in specific areas of the body, like the penis. Yet many of these blood vessels do dilate when the parasympathetic nervous system is active, especially those in the digestive and urinary functions. This dilation is mostly a response to a decrease in sympathetic nervous activity and the removal of all that excess epinephrine from the bloodstream, rather than any sort of direct action from the parasympathetic neurons. Now, remember, while the sympathetic nervous system promotes sweating while decreasing secretion from other exocrine glands, okay, it's probably not going to be surprising to learn that the parasympathetic nervous system has very little or no effect on sweat glands, but they increase the secretion from other exocrine glands. The facial nerve neurons will stimulate tear production from the lacrimal glands. Mucus production from glands in the nasal mucosa are also stimulated by the facial nerve. Fibers from the facial and the glossopharyngeal nerves are going to stimulate saliva secretion from salivary glands. And then fibers from the vagus nerve are going to stimulate secretion of enzymes and other products from the cells of the digestive tract. Now, where the sympathetic nervous system has those direct effects on metabolic rate, mental alertness, skeletal muscle contraction force, blood clotting, adipocytes, endocrine secretions, the parasympathetic nervous system has no direct effect on these, okay? Instead, these factors sort of return to a resting state where the parasympathetic nervous system is now dominant instead of the sympathetic nervous system. And this return to rest is a crucial time for the body to store important fuels like glucose in preparation for that next bout of sympathetic activity. And you're going to find that some drugs do block cholinergic synapses, and so many also block the effects of parasympathetic nervous system as a side effect. We will talk about that when we get to the quote-unquote A&P in the real world section. This is a great image, 14.10 in your textbooks, showing cranial nerves up here that innervate specific portions. So you see the oculomotor nerve goes to a postganglionic neuron very close to the eye, and this specifies its target cells and the main effects here. I'm not going to go over each of these in detail. I kind of just went over them individually, but I'm going to give you a chance to pause this and review. And remember that the vagus does most of these things. You see the vagus goes all the way down to the kidneys, okay? But the sacral then, that's when the sacral begins to come over, and it will innervate that lower portion here of the digestive tract, as well as the urinary bladder and genitals. So I'll give you a chance to review this. Just pause this video and get a chance to look at the targets, the main effects, and any cranial nerves or named sacral nerves that may innervate that area. All right, moving on. So yeah, A&P in the real world, we're going to talk about these side effects, the blocking of, or these anticholinergic drugs. Now these are drugs that either block acetylcholine release or acetylcholine receptors as an unintended side effect. Such drugs are prescribed for a number of different conditions like allergies, respiratory illness, gastrointestinal disorders, and these are referred to as anticholinergic drugs because they're blocking either the release of this cholinergen, acetylcholine, or they're blocking the receptors for it. And these can result in a wide range of potential side effects. Some of the more common unwanted effects include urinary retention. This works by blocking the relaxing effect of the parasympathetic nervous system on that urinary sphincter, making the passing of urine more difficult. You also have constipation. Anticholinergics are going to block the parasympathetic effects of smooth muscle in the digestive tract, and this is going to slow the rate of peristalsis, causing digestive food to move more slowly through the tract, and this can lead to constipation. You also have dry mouth. This is an effect brought on by the parasympathetic's inability to stimulate the secretion of saliva. You also have blurred vision. By blocking acetylcholine actions on the smooth muscles of the eye, anticholinergics have two effects. They prevent the constriction of the pupil, leading to pupillary dilation, and they prevent the contraction of the ciliary muscle, preventing accommodation for near vision. And both of these working together can really cause blurred vision. Now, as I already said, these two systems, the sympathetic and the parasympathetic nervous systems, do not function in isolation. Instead, what they do is they act together to maintain a very big number of these regulated variables and keep them in their normal ranges. In this particular section, we're going to learn about this working relationship between the two systems. Now, as I said, they sort of work antagonistically, they having opposite effects on a particular body function or organ. Now, together, the two maintain this balance and ensure that the body's needs are met appropriately. They accomplish this because most organs are innervated by neurons from both systems. This is a phenomenon called dual innervation. And it allows the sympathetic nervous system to become dominant and trigger effects that maintain homeostasis during exercise or emergency, but it also allows the parasympathetic nervous system to regulate these same organs and preserve homeostasis, when the emergency or exercise has finished. So this is that push and pull, the yin and yang. This is the balance that we strive for, this homeostasis. So here we have some comparison and contrast of the structures of the nervous system, the sympathetic nervous system and the parasympathetic nervous system. In the brain, you're going to see that the sympathetic nervous system maintains homeostasis during exercise, emotion, and emergency, and this is the rest and digest. This is its main role. These are homeostasis during opposite functions like digestion and formation of urine when you're not in these emergency situations. You're going to find the locations of their preganglionic bodies are in that thoracolumbar region of the spinal cord from here to here. And then in the parasympathetic nervous, it's the craniosacral division, remember? So it's cranium and sacrum. Preganglionic neurotransmitters. Look at that. It's acetylcholine both times. Postganglionic receptors, they're going to be nicotinic both times. Postganglionic neurotransmitters, remember, this parasympathetic I just talked about is all acetylcholine. Remember, both of them transmit acetylcholine. But the sympathetic is going to transmit norepinephrine and epinephrine, but it also has those cholinergic transmitters. And then you either have adrenergic or muscarinic in the sympathetic system, but you only have muscarinic in the parasympathetic. Okay, and this shows you a good breakdown where you have these adrenergic receptors here, and you have the muscarinic receptors here. Okay, I'll give you another chance to just pause this, look at it, understand it, and then we'll move on. All right, moving on. Now, neither system is ever completely silent. Both are active to some degree most of the time, and this constant amount of activity from each system is known as autonomic tone, and it's divided into sympathetic and parasympathetic tones. Okay, and interestingly, different degrees of sympathetic and parasympathetic tone can exist in different organs. The sympathetic nervous system is normally dominant in blood vessels and keeps them partially constricted at all times. This is important for maintaining blood pressure at rest. Remember, if your blood vessels were completely dilated at all times, when you stood up, gravity would drain all the brain out of your blood and out of your brain, and you'd pass out. The parasympathetic nervous system is normally dominant in the heart, keeping your heart rate at about 72 beats per minute. And this parasympathetic tone in the heart is often even stronger in athletes who have been conditioned to recover more quickly from those intense bursts of sympathetic activity. That's why you've heard if you're a marathon runner, you're going to have a lower heartbeat. This causes that lower heart rate. This physical conditioning, of recovering from sympathetic activity. This also dominates in the digestive and urinary systems, keeping the activity of these systems at normal levels. And that's why those anticholinergic effects can have such profound effects on this system. When this normal tone is disrupted, you can have several dramatic effects on the homeostasis. You can have postural orthostatic tachycardia syndrome that we'll discuss in just a little bit. Homeostasis maintenance is essentially the body's most important function, and the two divisions of the ANS are very crucial in how the nervous system overall fulfills this role. And now that you've learned more about the autonomic nervous system, we can revisit what you learned in the central nervous system chapter about homeostasis of vital functions. And I want you to remember that regulated physiological variables, these are largely controlled centrally by the hypothalamus and the brainstem's reticular formation. And many actions of these structures are mediated peripherally via the sympathetic and parasympathetic nervous systems. Many of these signals from the hypothalamus are directed toward areas of the reticular formation, and these are called autonomic centers. These centers contain neurons that control the activity of the preganglionic sympathetic and parasympathetic neurons. Although the hypothalamus does exert some control over these centers, the reticular formation can function even if the circuits connecting it and the hypothalamus are severed. This indicates that the reticular formation is most capable of controlling many of our critical autonomic functions like heart rate and blood pressure all on its own. Now, this shows a basic flowchart of what I've just discussed, where the cerebral cortex will send a signal down to the hypothalamus, and the hypothalamus will send that signal to the reticular formation, or this step could be bypassed altogether since the reticular formation is essentially the main player for homeostasis, especially heart rate and blood pressure. Now, for the functions we've just talked about, those signals are sent to autonomic centers for output to the sympathetic and parasympathetic neurons, those preganglionic neurons in the spinal cord or the brainstem. They're sent there, and these are going to control heart rate, blood pressure, organ blood flow, digestion, metabolic rate, and urine production. Now, these are, again, remember, these are broken down into sympathetic and parasympathetic, where each system has its own push or pull on the functions. You're also going to find that the hypothalamus and the reticular formation receive input from, like I said, the cerebral cortex, but also the amygdala. And this explains in part why emotion has such a profound effect on visceral functions. When you're excited, this mediation by the cerebral cortex and the amygdala is then passed on to the hypothalamus, the reticular formation, and finally the ANS, which is why you can notice an increased heart rate, elevated blood pressure, and other signs of sympathetic activity when you're excited or when you're attracted to somebody. If you've ever heard the old adage, when you're looking at the person you love, your pupils will dilate. This is the mechanism they're talking about, and it's true biologically. Now, although the nervous system plays an important role in maintaining homeostasis, it is only part of the story. It is the signals are sent through here, but the actual workers are we're going to talk about in the endocrine chapter. Chapter 16, we'll discuss that. Now, if we talk about some more A&P in the real world stuff, POTS, postural orthostatic tachycardia syndrome, this is characterized by an abnormal increase in heart rate, this is tachycardia, that results from an individual moving from lying or sitting down to standing up. This inappropriate rise of heart rate is accompanied by the vasodilation of blood vessels, and this will generally cause that blood pressure to drop due to gravity. This is what you're going to see with people consistently going from sitting down to standing up. They'll get lightheaded or dizzy or fatigued, and another common symptom is thirst. Now, this low blood pressure also reduces blood flow to organs that can lead to shortness of breath, chest pain, cold extremities, and muscle weakness. And the basic cause of POTS has yet to be determined, okay? But it appears to be caused by excessive sympathetic activity or excessive sensitivity of sympathetic receptors to epinephrine or norepinephrine. Normally, when a person stands up, the sympathetic nervous system temporarily raises the blood pressure to ensure that blood flow remains constant against the force of gravity. The sympathetic response gradually tapers off, and the parasympathetic tone resumes control of the heart rate. If in a person with POTS, however, the response is the sympathetic stimulation is exaggerated, leading to this characteristic symptoms. Treatment for these individuals usually consists of dietary modifications like increasing water and salt intake, introducing a more intense exercise regimen, or medications that block sympathetic receptors. And most patients will eventually, gradually see some improvement to the condition, but some will struggle with it for the remainder of their lives. So a good way to think about the different effects of the sympathetic versus the parasympathetic nervous systems are going to be, I'll outline here. Now, because their names are similar, it's easy for you guys to confuse them. It's easy for me to confuse them. But this issue can be addressed using a couple simple mnemonics and a bit of logic. Okay? For the sympathetic nervous system, remember that it promotes survival in emergency situations. And with that in mind, let's try to remember the following mnemonic. You are walking through the woods when suddenly a swarm of bees starts chasing you. Your sympathetic nervous system is sympathetic to your situation, and it is going to initiate changes in your body that will make it easier to escape the bees. Now, this next part is where logic comes into play. Without memorizing anything, you can use logic to figure out what physiological changes would help you escape a swarm of bees. Making your muscles more active while you're running. Blood flow increases to those muscles. Blood flow to other organs that aren't currently needed, like digestive organs and skin. Those are going to decrease. So you're going to have vasodilation to your skeletal muscles and vasoconstriction to your digestive organs, urinary organs, and skin. You're going to need more oxygen to fuel the demands of your skeletal muscles. So your bronchioles are going to dilate. That allows more air to be exchanged with each breath, right? Because you're running away from these bees. You're going to be panting while you're running. Your heart will need to beat faster and harder to keep up with the increased demand of you running from these bees. They're gaining on you. This increased heart rate is going to increase your blood pressure and keep you upright. And because you're running through the woods, your eyes need to gather as much light and information as possible, so your pupils will dilate. Okay? That's the sympathetic nervous system. Now, your parasympathetic nervous system restores resting conditions after that burst of sympathetic activity. So try to remember this following mnemonic. You have escaped the swarm of bees, but not without receiving a few stings. Your parasympathetic will help you repair, rest, and recover from your escape. And here comes the logic, okay? To repair tissues, you need to take in nutrients, which requires digestive activities. So all those digestive processes are going to increase. When you take in food, you also need to take in liquids, okay? So this results in the formation of urine. And urinary processes increase. Your muscles are no longer actively moving, so blood flow to the muscles decreases. You have vasoconstriction in your skeletal muscles, but your digestive and urinary organs are actively working, and so their blood flow increases. This is vasodilation. Now, note that this is due only to decreased sympathetic activity. Okay, remember that. You will no longer need that additional oxygen, so your bronchioles will constrict back to normal and your heart rate will slow, so you're lowering your blood pressure. And since you aren't running through the woods anymore, your eyes don't need to collect as much information. Your pupils constrict, your lenses adjust for near vision. okay? And these are just a number of changes. This is a sum of the changes mediated by the sympathetic and parasympathetic system. If you look back at that chart, you're going to see all of those systems and how they interact. But it helps if you think about them in this sense: fleeing to escape a swarm of bees or recovering from the escape. And this, if you remember this as this concept, it will probably help you more than just memorizing it. At least in my experience. So that's it for chapter 14. Let's review everything that we've gone over. In chapter 14.1, that was the overview of the ANS. Okay, so you learned that the autonomic nervous system performs many of its functions via a series of visceral reflex arcs. Okay, you also found out that autonomic motor neurons consist of preganglionic neurons that are going to synapse on autonomic ganglia, and then postganglionic neurons that contact the target cells, okay? You also learned that the autonomic nervous system is made up of both the sympathetic and the parasympathetic nervous systems. Which brings us to 14.2. We talked about the sympathetic nervous system and how it is often called the fight or flight division of the ANS. You also learned that it's called the thoracolumbar division, as most ganglia are part of the sympathetic chain ganglia right next to the spinal cord. You also learned that preganglionic sympathetic axons release acetylcholine at their synapses with postganglionic neurons. Okay, then the postganglionic axons are going to release norepinephrine, epinephrine, or acetylcholine at either adrenergic or cholinergic receptors. Remember the two differences: norepinephrine and epinephrine to adrenergic, acetylcholine to cholinergic. Adrenergic receptors bind that epinephrine and norepinephrine within one of the 5 classes of their receptors: alpha 1, alpha 2, beta 1, 2, or 3. And then the cholinergic receptors bind acetylcholine, and there are those 2 types. There are muscarinic receptors and nicotinic receptors. The sympathetic nervous system then increases blood pressure by raising the rate and force of contraction of the heart, and also by causing that vasoconstriction. It also causes bronchodilation and vasodilation of the skeletal blood vessels in the skeletal muscles through norepinephrine. Then you're going to find that the adrenal medulla is made up of modified sympathetic postganglionic neurons. And then when stimulated, the adrenal medulla releases the epinephrine and norepinephrine into the blood as hormones. So that's a neurotransmitter to hormone reaction there. And then sympathetic activity decreases urinary and digestive functions and the secretions from most exocrine glands, except sweat glands, while it then dilates the pupil, increases levels of metabolic fuels in the blood, and then increases those sweat gland secretions. And then in 14.3, we talked about the parasympathetic nervous system. And the parasympathetic nervous system is that rest and digest division, which performs the body's maintenance functions such as digestion and urine formation. Also called the craniosacral division, because the preganglionic axons are in the the preganglionic cell bodies are in the cranial region of the brainstem or spinal cord, and then the sacral division of the spinal cord. And these axons, these preganglionic axons, synapse with the cell bodies of postganglionic neurons in ganglia near or inside their target cells. And then in both cases, the pre- and postganglionic neurons here release acetylcholine at their synapses. The parasympathetic nervous system lowers the blood pressure, where the sympathetic division raises it. The parasympathetic nervous system lowers blood pressure by lowering the rate of contraction of the heart, lowering the rate and the force of contraction. And then you're also going to find parasympathetic activity causing the constriction of the pupil and allowing that lens to focus for near vision. It's going to cause bronchoconstriction back to normal diameter, contraction of digestive smooth muscle, relaxation of digestive and urinary sphincters, and engorgement of the penis or clitoris, as well as an increase in secretion for most glands except the sweat glands. And then in 14.2, we kind of put homeostatic effects all together and the peripheral nervous system's maintenance of the homeostasis. You found that they work together, but often antagonistically. And you found out that the autonomic tone refers to that constant amount of activity present in each system for most of the time. And you really learned that homeostasis is controlled centrally, remember, by the hypothalamus and the brainstem's reticular formation, but many of the signals sent by the hypothalamus are directed toward autonomic centers in the reticular formation. And that is also mediated also by the amygdala, which can result in those emotional impacts on the visceral nervous system. And that's really it for chapter 14. If you guys have any questions about any of the material at any time, do not hesitate to email me. You have my MS Teams information. You can send me a message there. I am always available. My virtual door is always open. I will see you guys in the next one.